So I'd like you to actually just give your thoughts about like what the filter's doing, and how this ties back to some of the sort of things available to the general public that they could do for themselves.
Okay, so I mean, one of the first things that you see is the loss of shadow lines. In particular, if you look at the central part between your eyes, which is called the glabella, you can see that you don't have a line there anymore. And you also notice that if you migrate down to the lower face, you're losing the shadow in the cheek area, which is known as the nasolabial fold. And a lot of that has to just do with, descent of the tissues with age, laxity and whatnot. And then the other component is volume loss. So, oftentimes as we age, we tend to lose a little volume in what I call the submalar triangle region, and that's what causes people to look a little shadowed. And then that, combined with descent of the cheek tissue, will cause this nasolabial fold to be a little more accentuated as well. The other area in the lower part of the face that we tend to look aged is we start to get shadowing down here. And this correlates to the oral commissure area, what we call the marionette line zone. And a lot of that has to do with loss of bone density in the mandible, which is your jaw. And you really see it more in women. And I think a lot of that has to do with just the male mandible is much thicker and larger compared to the female. And with that, you tend to get a little bit more deepening. So the last thing I'd probably say that really sticks out, Frank, is just your skin tone. Your skin tone looks much more uniform and consistent in the filtered image, whereas in the actual, you can see you got some skin tone changes. That's also related to inherent loss of some laxity in its skin as well. So, the combination of the skin, the volume loss, the laxity, are all the things that you're seeing between the filtered versus non-filtered. Now, the things you can do to help, maybe prevent this from occurring is, once you get into your late 20s and 30s and on, using products like Botox or Xeomin, which are the neuromodulators, which help to decrease the muscle action, particularly in the forehead, the glabella, because the line forms because over time, as the muscle is contracting, it's pulling on the skin tissue. That, combined with age-related changes as well as changes associated with sun, will lead to this deepening here. Same thing with the horizontal lines in the forehead, and then also in the crow's feet area. So that's where your neuromodulators can do their work. For the mid-face and the lower face, non-invasive options would be doing fillers, for instance. And basically where you're looking to enhance is, again, putting some volume in the submalar cheek zone, as well as along the cheekbone here. You can put some filler in the fold. I tend to avoid doing that because, again, the reason why you're getting the fold is because of the descent and loss of volume. So oftentimes people focus on putting too much volume and it looks very unnatural. You can also put some volume in this area here. Now, your face that's non-filtered doesn't exhibit as much, but as people start to get jowling through here, that's when you got to start talking about, utilizing surgical procedures like a facelift, for instance. In the lower part of the neck area, when people get a lot of fullness, you can do liposuction. If there's more banding associated with muscle descent and laxity, then you got to also think about doing a neck lift. For the mid-face area, when we were talking about the fillers, the more permanent options would be taking fat, for instance, and doing what's called fat grafting to this area. You can also do implants as well. So, there are a lot of things you can do to, help prevent aging. Obviously, we're not going to stop it. Certainly, wearing sunscreen at a younger age will help prevent pigmentary discoloration and changes, and it'll also help with making the skin look more youthful. An option for people that were not wearing sunscreen, taking care of their skin, would be to do laser resurfacing. I also encourage patients to do a skincare line. Skincare is so important, and you have to have a retinol that helps to essentially promote skin cell turnover. The analogy I give for skincare is kind of like exercise for the skin. And what I mean by that is, if you go to the gym and work out for a week, it's not going to do anything. The effects and the results and the benefit of working out is something that's seen over months. And certainly if you do it over years, you're going to maintain a more youthful and refreshed look. It's the same exact thing for skincare. And skincare involves not only putting on, a retinol type product in the evening and during the daytime, but it also involves putting on sunscreen and moisturizer during the day. Sometimes people need to get some superficial peels, maybe once or twice throughout the year. And again, it really depends upon the depth of the peel. And then, the next level up would be to do, ablative resurfacing. So, that little treatment regimen just for the skin will help prevent the aging. So as you can see, there are a lot of different things that can be addressed, but really those are the things that I'm seeing in the filtered versus the non-filtered image.